afternoon, and good evening to everyone. I want to thank you for joining us from all around the world for this important panel discussion entitled Pathways to Ensure Women's Equal Access to Global Health. My name is Mehmet Kılıç. I'm the president of the Journalists and Writers Foundation, an international civil society organization dedicated to the culture of peace, human rights, and sustainable development, which is based in New York and associated with the UN Department of Global Communications. Dear guests, as you know, UN Commission on the Status of Women is a significant time when women leaders and delegations from all around the world convene in New York to celebrate women's rights, raise awareness on gender equality and women's empowerment, and more importantly, stand in solidarity to make meaningful and positive social change in society. This year, we are happy to collaborate with 16 NGOs from 7 different countries to organize 14 panel discussions, 1 high-level reception, and 1 field screening on women's rights. 2025 also marks the 30th anniversary of the Beijing Declaration and the Platform for Action. The main focus of the 69th session of the CSW is to review the implementation of the Beijing Declaration and the Platform for Action. Today, we have an important panel discussion ahead of us, which will focus on women's equal access to global health. We have an amazing line of speakers who are experts in their respective fields. And I have the pleasure of introducing the moderator of today's panel discussion, Dr. Priyanka Chahal. Dr. Priyanka Chahal is a medical doctor and a global health researcher currently pursuing a master's in global health delivery at Harvard Medical School. Her study focuses on the health policy, infectious disease, leadership in advancing the rights and well-being of women, youth, and marginalized communities. Dr. Chahal has led multiple youth empowerment projects across India and Central Asia, addressing issues such as gender equality, women's empowerment, human rights, and sustainable development goals. She played key leadership roles within the World Economic Forum's Global Shapers community, where she worked to amplify youth voices and drive social change. In her role as the youth representative of the Journalists and Writers Foundation to the UN Department of Global Communications, Dr. Chahal actively engages in global advocacy, promoting inclusive development and women's empowerment. Dr. Priyanka Chahal, you have the floor.
Thank you so much, Mama. That was a very beautiful introduction. Hello everyone again. I warmly welcome you all to this amazing panel discussion that we are having a roundup of great speakers with us today. And as my colleague Mehmet mentioned, the 69th session of Commission on the Status of Women is currently underway at the United Nations headquarters in New York, which is taking place from March 10th to 21st. And today actually marks the beginning of the second week of this very important global gathering. And the focus of CSW69 is to actually critically examine the review progress made in implementing the Beijing Declaration and Platform for Action 30 years after its historic adoption which was adopted in 1995 in Fourth World Conference in China. And this framework is actually articulated an ambitious and transformative vision for advancing gender equality, the empowerment of women and girls in every dimension of life, whether it is civil, social, economic, or political. And as we are gathering here today, it is clear that we are far from fulfilling this vision. So, a renewed global momentum is urgently required to address persistent inequalities across the 12 critical areas of concern, where one of the areas is, of course, women and health. Before we begin today with our expert speakers, I would just like to mention brief kind of like introduction why social justice, health, equality, and health is very important and why gender-based discrimination is happening. So access to health is not just simply a matter of availability, it is a fundamentally an issue of justice. As Dr. Joy Mukherjee and late Dr. Paul Farmer, which are kind of my ideal from Harvard Medical School, have argued, ill health is often a direct result of structural violence, the systematic social, economic, and political inequalities that inordinately affect the impoverished and marginalized community. Women and girls that, especially those living in poverty or in fragile and conflict affected settings, are more likely to experience these barriers to healthcare when compared to men. And these barriers are shaped by gender based discrimination, entrenched social norms, economic dependence, and geographical isolations, which is eventually compounded by a biosocial reality in which there's all of the structural inequalities embodied as a disease, I would say. There are a lot of different factors that are actually contributing to it, and we would love to hear from our expert speakers today. Um, and by centering the women health and rights in our discussion, recognizing it as a human health right and a global public good, we align it with our core values for Beijing Declaration, and which is a realization of the 2030 Sustainable Development Goals too. Also, just for our audience, just a brief remark. We will be having the question and answer session at the end of this session. So please feel free to write in the chat box or comment or raise hand um, as we move forward. And also, we are currently live on our YouTube channel, but also on NGO CSW webpage on VOA. So we are having global audience joining us. Now it's time to move to our speakers, and I would like to introduce our first speaker, Atefeh Riazi. I would like to introduce her in a very brief way, and then we'll be heading over to her. She is the leading authority in cyber technology and artificial intelligence with a distinguished career that spans both the public and private sectors. Currently, she serves as a senior vice president and chief information officer at Hearst Corporation, which spearheads transformative technology initiatives and drives innovation within the company, including which is related to the healthcare innovation and technology as well. Um, Prior to her role at Hearst, she led dual position as senior vice president as well as interim chief digital officer at Memorial Sloan Kettering Cancer Center. There, she played a key role in advancing healthcare technology from tech adoption to research and to patient care. And she also served as 7 years as Assistant Secretary General and Chief Information Technology Officer at the United Nations. So, without further ado, I would like to pass the floor to Ati, who will be speaking on human rights as the foundation for health equity, and of course, will be sharing some of our experience for technology and healthcare perspective. Over to you, Atefeh.
Thank you so much, Priyanka, and thank you, Mehmet. It's wonderful to be joining you today, and I feel so inadequate being among such amazing panelists who have great knowledge of healthcare. So I'll try to focus my comments around technology and my experience in various sectors, which has involved healthcare to some extent. I want to start with my experience at Ogilvy and Mather. I was a global CIO of Ogilvy and Mather, which is an advertising and communications firm. And I never forget my trip to a place called Guayu in China. I used to travel a lot to the BRIC markets. China was one of them. But I had a weekend off and I decided I want to go to this town because I hear it's the center for dismantling computers. And me, just like any good CIO, we tried to send our servers and storage and PCs and laptops to the south, hoping that they would get reused. Imagine my horror when I walked into this place and saw pregnant women with their bare hands dismantling servers and switches and PCs, and children dismantling the wires. And at that point, I realized that we have a serious issue with electronic waste, and it's impacting women. Because women are doing this job, it's the only job they can find, and the impact of lead and mercury in the soil, in the water, in the bodies of these women and children was horrendous. And if you look at the amount of technology we ship, a lot of it is shipped to China, is shipped to India. In India, I've seen young men and women burning electronics, which causes what similar to a dioxin, which was Agent Orange chemical. So all these people touching this equipment, dismantling it with their bare hands, have 3 times the possibility of getting cancer and birth defects for the women that are pregnant. A serious issue. So as we think about technology and we think about innovation and we see whether women are equally benefiting from it, what we see in the space of electronic waste is that they're not benefiting. It's actually hugely impacting people in poverty, especially women and children who are involved with electronic waste. Now, you cannot dismantle electronic waste in the US unless you're a prisoner and wearing a full hazmat suit. So it is what we call the no unless policy. No, you can't do it unless it's another country that doesn't have regulation or care for human rights and healthcare conditions of people, and especially women. And at that point, I started an organization called CIOs Without Borders to focus on advocating for good policies around technology, usage of technology, but really with the first focus was on electronic waste. Moving on, I moved from there to an entity, government entity, and then to the UN. And at the UN, you see many crises. Of course, we saw the Ebola crisis. In 2014, 11,000 people died, but who bore the greatest burden? 75% of the victims were women, because they are the caregivers, they are the nurses. Even in the US, most caregivers and healthcare professionals are women. And this is true with HIV and AIDS. 37 million people worldwide are living with AIDS, but in Africa, young people, young women, teenagers are dying from AIDS. Every week, 4,000 girls and young women in Africa get HIV. 63% of all new infections. A lot of it is because of sexual violence. So when we think about healthcare, there's underlying causes such as sexual violence, such as unrest, such as war, such as poverty, not lack of rights and laws for women, trafficking of women and children, which is a huge issue. So all of these causes health-related issues for women. You look at the war, and again at the UN, we saw Ukraine and Yemen and Syria, and recently with Palestine and all of the refugees. And if you think about the condition of refugees, again, women and children, not only that all healthcare facilities have been destroyed, but millions and millions of people not having access to women to healthcare. And a lot of the refugees happen to be women and children. So again, we have a serious issue in terms of getting healthcare. And then a little bit about my experience as a CIO of Sloan Kettering, which is a cancer hospital and a number of hospitals. And I went to this role a month before COVID. And we had talked about remote care for a long time, except that we said it would happen in the future, and the future happened overnight. And 70% of, at that point, when we were looking at COVID and providing support, we realized that 70% of healthcare workers were women. And they were coming in when others were at home. And it hugely impacted women, not only as caregivers at home, but as caregivers in the hospitals. But there was something interesting with COVID. And I think as I start with technology and negative impact of technology, I want to kind of wrap up with a positive impact of technology, because for the first time, we could provide remote care, digital care. We can make care affordable, and we can provide care. If you close the digital divide of access to the internet, you can provide care globally. So although it was a tragedy and it impacted so many people, but it brought us, it kind of did a leapfrog to the place where now we can have access to digital care remotely. And I think there is value in technology as long as it's responsible innovation, that we can begin to close these gaps of healthcare, of education rights, as long as we close the digital divide. Over to you, Priyanka. Thank you.
Thank you so much, Atefeh, for your insightful remarks. I was actually taking my notes, and you powerfully highlighted the role of technology and human rights in advancing health equity, also emphasizing the digital innovation. And that must be inclusive and ethical to close the gaps in healthcare access for women. And I also appreciate your example you just mentioned, that how digitalization of health is very important, especially to deliver the healthcare services in the remote areas or in the conflict settings, and how it can be affordable to who can't access the traditional healthcare. Thank you so much. Your remarks are really helpful for us to learn more as well from your experience. Now we are going to move to our second speaker, Dr. Niescierenko, Director of the Health Program at Boston Children's Hospital, Harvard Medical School. Dr. Niescierenko is a pediatric emergency medicine and public health physician and founding chair of the Global Health Program at Boston Children's Hospital. Um, and Boston Children's Hospital is a partnership-based working to improve child health through research, program implementation, and education globally. She has experience in pediatric care, public health, and health system building with host countries, governments in more than 30 countries. Wow. On 5 continents, as well as with World Health Organization, the World Bank, US CDC, USAID, and in various global non-governmental organizations as well. Her career focused on building sustainable system in fragile economic, humanitarian, and conflict settings. In Liberia, she provided pediatric humanitarian aid in the immediate post-conflict setting, bringing local hospitals together with U.S. academic institutions, which extended to 17 years of partnership. And during the 2014 to 2017 Ebola outbreak, it was a very critical situation. She led the Liberian public hospital response, utilizing rapid deployment of local healthcare workers to provide training, reaching 23 of hospitals with over 5,000 healthcare workers. So she's a very experienced person, a great doctor, and she'll be talking about global health delivery in achieving sustainable development goals. So over to you, Dr. Michelle.
Thanks, Dr. Priyanka. It's my pleasure to be here with my esteemed colleagues to continue to give voice and advocate for gender equity and health for women and girls. As the introduction referenced, after the Beijing Declaration between 1995 and 2015, the first 20 years, health indicators for women and girls improved. Global maternal mortality dropped by 44%. However, since 2015, we've had important progress despite the COVID-19 pandemic toward achieving the new Sustainable Development Goals, or SDG 3, towards good health and well-being. The world's striving towards gender equity is one of the most direct and potent ways to reduce health inequalities and achieve this SDG. However, lack of control over resources, gender-based violence, the burden of unpaid care and domestic work, longer working hours, and unhealthy working conditions, like our first speaker identified, is impeding women's ability to lead healthy lives. Compounded by fragile and complex settings, where 49% of the world's refugees are women, and over 612 women live within 50 kilometers of active conflict, worsening their health indicators. The health sector is an increasingly data-driven one. For SDG 3, there are 6 conceptually clear indicators embedded in the monitoring of the outcomes and the progress towards achieving SDG 3, with established methodologies and standards that are regularly reported on by countries that help us assess progress towards gender equity and health. These 6 indicators, which in health we're lucky to have, some of the other SDGs I think have less tangible ability to measure their progress, but our 6 key indicators are maternal mortality, skilled birth attendance, adolescent pregnancy, family planning use, new HIV infections, and the coverage of essential health services. As a pediatrician, emergency physician, and public health physician, this data matters to me on a day-to-day basis. We can't improve what we don't measure in health. However, women are more than just the numbers behind these statistics and are affected by them in different ways. And there are many women out there leading the charge towards changing them. And so I'd like to share some of the statistics on the progress towards SDG 3 and the innovative health solutions led by women that I'm honored to call partners, collaborators, friends, and leaders that are addressing these numbers. And so by the numbers, global maternal mortality has been relatively stable since 2015. 227 women per 100,000 died a year in 2015. 10 years later, this number has only dropped to 223 per 100,000. Not much change. However, this varies regionally, with the highest rate in Africa, a staggering 530 women per year, per 100,000 population die per year. Another indicator related to this is skilled birth attendance, which ranges globally from less than 65% to as high as 98%. My friend and colleague, Professor Hadiza Galdanchi, an obstetrician and gynecologist leader of the African Center of Excellence in Population and Health and Policy, or ACEPOP, led the Nigeria team for the Emotive trial, which was published in the New England Journal of Medicine and describes the use of a calibrated, super simple drape for normal deliveries. And this detects postpartum hemorrhage early and triggers health workers to respond with bundled treatment, reducing severe outcomes by up to 60%. This work is changing WHO's guidelines on the treatment of postpartum hemorrhage, and the ACEPOP newly launched simulation center at their home university in Bayero, Kano, Nigeria, is training skilled birth attendants using this new approach to start moving the needle on those 531 women per year. Indicator 3, adolescent pregnancy, globally accounts for 1 in 10 births. However, Latin America and the Caribbean, as well as sub-Saharan Africa, it accounts for 1 in 5 births. Adolescent birth rates are also tied to the 4th indicator, where 1/3 of women globally lack access to family planning. Nurse Mrs. Shirley Fanbala in Liberia has created a program to work in rural villages, incorporating microeconomics and skill building to generate household income, which gets girls and boys back into school, where then school health clubs developed by the partnership work with the girls and the boys to educate on sexual and reproductive health, promoting healthy choices, access to family planning, and a place for dialogue in this early and vulnerable adolescent period. New HIV infections are the 5th indicator, with 44% of new HIV infections occurring amongst women and girls. Women who experience gender-based violence are 3 times more likely to contract HIV, and 95% of all sexual violence in conflict is suffered by women. Nurse Amber from Bihar, India, identified the barriers to nurses, who are predominantly female, working in emergency departments at night to deliver much-needed emergency care. Nurses were not coming to work. They felt unsafe without light, access to bathrooms, and security, putting them at risk for gender-based violence in the workplace, let alone the women experiencing these in the communities. Addressing these needs in the workplace demonstrates respect for women, the professional achievement of the world's 29 million nurses, and ensuring the workplace is safe and secure from gender-based violence, allowing critical care to be delivered. Finally, on essential health coverage indicators, there's less than 60% coverage in 1/3 of the world's countries. After the civil conflict in Liberia, my friend and mentor, Dr. Rosita Marshall, took on a retirement job at an age I won't describe, or she would probably be mad at me, to launch Liberia's first ever pediatric residency training program, which also was paired with obstetrics, gynecology, surgery, and internal medicine, to generate the next generation of leaders within Liberia from Liberia. There are now 35 Liberian-trained pediatricians, 4 of which now serve in the Ministry of the Health, the first ever in the government. 3 of those are women, who are expanding access to essential health services for women and children. Progress on achieving gender equity and delivering global health and achieving SDG 3 by these 6 indicators still has a long way to go based on the numbers. However, the world's women leaders and innovators, the Hadizas, Shirleys, Ambers, and Rositas, are leading the change to make local changes ripple nationally and internationally to meet the needs of women and girls. I end this with a call to action to help identify these new solutions, elevate the voices from the field making them so they can scale and reach women and girls globally. And so thank you for letting me join this panel.
Thank you, Dr. Michelle, for sharing this, your own experience as a pediatrician and public health physician for also delivering the services. And as you mentioned, the data and the statistics are very important for designing and even implementing the effective healthcare programs. I also like the fact that you mentioned that there are some programs which are actually led by women, and that's also the women leadership in healthcare sphere is very important, because if you are being a woman, you relate your problems with others who are really experiencing, especially the gender-based violence, and how um, you mentioned about the increasing of HIV infection, which are related to gender-based violence, sexual violence, and affecting the health outcomes. So thank you for joining us today. And I know you are already on your duty. But we will be catching up with you later in our question and answer remarks. Now let's move to our next speaker. Our next speaker is Dr. Anatole Manzi, Deputy Chief Medical Officer at Partners in Health. Dr. Anatole Manzi served as Deputy Chief Medical Officer in Change in Clinical Quality Health System Strengthening at Partners in Health. And in his current role, Dr. Manzi lies with PIS-supported countries to develop and implement quality improvement and health system strengthening strategies. His work involves engineering innovative solutions to integrate quality management and clinical practice. He also manages the relationships and engage with partners, including academic, non-academic, global health organizations, and to support the implementation, evaluation, and dissemination of quality care delivery practices. Dr. Manzi is also the founder of Move Up Global, which is a Boston-based organization striving to improve access to better health and education in remote and resource-limited settings. Dr. Manzi is an assistant professor at the University of Global Health Equity, Rwanda, and also an adjunct professor of global health at Tufts University and a lecturer in Department of Global Health and Social Medicine at Harvard Medical School. So it's such a pleasure, and he will be discussing about the role of social medicine in advancing the health justice. So thank you for joining us, Dr. Manzi. Over to you.
Thank you so much, Dr. Chahal. And this is a really an incredible opportunity. And thank you, everyone, for allowing me to spend the time with you. It's when it comes to social medicine, I want to really start with my 20 years now. I think 20 years ago, I was one of those who were launching the first HIV care and treatment health centers in the rural Rwanda. And I remember one of the women who were enrolled in the program who came to seek medication for pain, but she could not break in. The queue was very long that she could not really break in. So what she did is just going back home in that pain, and she could not really resist. What happened is that same evening, she committed suicide. She left 2 children, beautiful children, and no one really there to take care of them. When I saw the topic when it comes to pathway for women to access care, I kept thinking about her. I think the situation changed, improved significantly over the past years, but believe me, there is still a need for access. Women are still facing issues to access the care that they need. As we know, I think there were some statistics that were shared in a previous presentation. WHO reported that every day in 2020, almost 800 women died every day from preventable causes, especially during pregnancy and childbirth. And the mortality obviously was high, 287,000 for women. Women died during and following pregnancy, that same year. And again, obviously, there's nothing surprising, because when we say 95% of these deaths occurred in low and middle income countries, it actually tells us who is at risk. So when we say access to global health, it's really important to understand that women are paying the high price. And it's important that we reflect on that. When it comes to social medicine, unlike medicine, the modern medicine that we know, which focuses on a biological and medical aspect of health, social medicine explores how social and economic factors impact health, disease, and the practice of medicine. It emphasizes on addressing the root causes of health inequities, such as poverty, education, and living conditions. Social medicine also should cover the political determinants of health. Daniel Doge puts it very beautifully that political determinants of health include resource and power distribution, which shape and or hinder opportunities to advance the health equity or exacerbate the health inequalities or inequities. So the role of social medicine really should not be understated, especially in times like these when we are talking about our pace toward achieving the Sustainable Development Goals. It is important to understand that the social determinants of health, such as income, education, housing, they play a crucial role in shaping the health outcomes. In the case of my patient who went back home and committed suicide, I always wonder what could have done better to actually prevent that. Did she have abilities to visit another clinic nearby? Was the clinic able to actually have more than one or two nurses or doctors to take care of her? Did she have the means she needed to actually even get the medication she wanted that time? It is really important that we reflect on a social medicine. How do we do that? But before we get there, I think I want to share more of the statistics. When it comes to gender gaps, we should all feel a sense of urgency. Gender health gap equates now 75 million years of life lost collectively per year due to poor health and early death. In most of cases, including chronic conditions, the chronic conditions, especially cardiovascular diseases and cancer, women are often diagnosed later than men for the same conditions. So this is really key. So we need to think about the impact of COVID-19. Even though it has been a few years, the UNFPA reported that 12 million women in the poorer countries, lost access to contraception during the pandemic, and actually that system did not recover. Many systems in many countries did not recover from the pandemic. Therefore, women are still facing issues in accessing those services. Social medicine helps to address these disparities by improving access to quality women's health, and that is really important. I don't want to spend too much time really lecturing about social medicine, but I'm trying to really think about what it takes to be able to adopt social medicine and how social medicine can get out there. First off, we're going to need a paradigm shift, right? I think, Priyanka, you put it very well, that the structural violence that we need to navigate, but we need also these structural change from education to representation in the government to economic opportunities for women, because they're facing that financial hardship. They can't access to opportunities they need. They can't have means of transportation to get to the nearest health center. They're taking care of families and they are in charge of the families. They actually need to be there for the children. How do we allow women to get there? How do we address the structural change, the barriers that we see for women to be able to access? I mentioned education. It's very important to understand, how do we train our health workers? The principles of social medicine should actually guide our education. The who and how we train is really critical. Partners in Health has a university in Rwanda. It's the University of Global Health Equity. This university is unique in that sense that the doctors and nurses who graduate from that institution, they understand these social determinants of health. They know that when a woman shows up, it's not about their pain. It's also about what they go through and their household, the violence they have, the domestic violence that they face, their economic capital. They understand what is involved to be able to have healthy status. And that is really important. How we train the next generation of healthcare workers is really important. That's where social medicine comes in. We need a shift in programming. So especially from vertical programming to integrated care. Have you seen a woman coming for vaccination in a health facility and they give them another appointment to come for contraception? Why can't we integrate those services? That is really holding women back and really limiting their access to education and to services they need to have better health. And thirdly, I want to talk about a concept of empathy. Empathy should be a value. We have a moral obligation to ensure that women have access to healthcare. And this is a human right, it's basic. If we lose everything, can we keep that empathy that women deserve to have a equitable access to healthcare services? New ways of measuring. I think it's always important to look at the statistics. So I like the presentation, Michelle, that I gave, really talking through the statistics. Now, oftentimes we look at how many women die during childbirth, and we don't even remember that there are those women who are not even bearing children. And the most known statistic at this point is how many women die giving birth. But what about those who are not giving birth? I think we need to revisit our measurement, our metrics, because that is important. And social medicine is considering all those aspects. And lastly, I want to talk about the leadership and accountability. Countries should deliver on their commitment. I have to tell you that there's for those on the African continent, you may know the Abuja Declaration, where countries committed to spend 15% of their GDP or their budget, the national budget, on healthcare. But as we speak now, only 6 countries were able to allocate 15% to health. So social medicine requires an intentional investment in healthcare for countries to be able to know women are coming. It's not about only the biological. We need to think about their needs and how to address that. We need to address the root causes of disease, and poverty comes in. I want to end here saying that social medicine is a need in times like this, especially as we struggle to achieve sustainable development goals that we set and oftentimes remain education and does not translate in action. I very much look forward to this conversation where we can collect ideas and have a frank conversation on how we really make this happen. Thank you.
Thank you, Dr. Manzi. The remarks were really powerful, and we hope to continue this conversation even after the wrapping of this panel. On this, these ideas that Dr. Manzi mentioned, I'd like to emphasize, I remember a quote from Rudolf Virchow, who is often called as the father of social medicine and also father of modern pathology. So he said that medicine is a social science and politics is nothing else but medicine on a large scale. So that means there are multiple factors, multiple social, structural, economical, psychosocial factors that are really contributing to how impoverished communities, including the marginalized population, which are women and children, are getting affected more out of all of these factors that somehow are leading to, like kind of operation on them. And as Dr. Manzi mentioned, that there are every day over 800 of women are dying from the preventable causes, which are mostly from the maternal death during the pregnancy as well. But we will continue this conversation as there's always a lot of to discuss and learn. And now it's time to move our last and final speakers, but please stay with us as we'll be opening the question and answer floors for a great discussion with all of our speakers. I'd like to introduce our another expert speaker, Dr. Umut Duygu. She's the ophthalmologist and registered naturopath at Golden Life American Hospital in Mali, and she's joining us today from Mali. So this panel discussion is really global. Dr. Umut was born in Ankara, Turkey, where she studied medicine and specialized in ophthalmology. Throughout her career, she has performed over 10,000 eye surgeries. Since 2005, she has published numerous research papers and volunteered in Africa, providing free eye surgeries to those in need. In 2017, Dr. Umut relocated to Canada to escape the political unrest in Turkey. After 18 months, she was able to reunite with her children while her husband joined 8 years later. In Canada, she pursued studies in naturopathic medicine, which allows her to serve Canadians as a naturopath and further assist those in need. She continues her work as an ophthalmologist in Bamako, Mali, focusing on cataract projects to help individuals who lack access to essential healthcare services. And today, Dr. Uzunel will be speaking on gender equality in the global health systems and sharing her vast experience from African continent and also globally. So over to you, Dr. Umut.
Thank you, Dr. Chahal. I'm so excited to be here. Let me start with a powerful statistic. Women make up 67% of the global health workforce, providing essential care to around 8 billion people worldwide. Yet, they hold only 25% of leadership positions. This imbalance raises an important question. How can we achieve a truly equal healthcare systems when the majority of those providing care are excluded from decision-making roles? So gender equality in healthcare means ensuring everyone, regardless of gender, has equal access to services, representations, and opportunities. But achieving this is more than just a moral obligation. It is essential for improving health outcomes, addressing disparities, and creating more effective healthcare systems for all. First, I would like to examine where we are today with some statistics. In the US, women pay 18% more for healthcare annually than men, partly due to more frequent visits and services. Studies show 24% of women report poor health-related quality of life compared to 16% of men, and discrimination plays a significant role. And the European Institute for Gender Equality reports that 16% of gender diverse people feel discriminated against by healthcare employers. So when I was studying at Naturopathic School in Toronto 3 years ago, I completed my internship at the Community Health Center that primarily served HIV positive people and gender diverse individuals. And I heard many heartbreaking stories about how they face discrimination within healthcare system. Many shared that they avoided seeking care due to these negative experiences, and this leads to delayed diagnosis and prolonged suffering for years. So what is stopping us from achieving gender equality in healthcare? First of all, I can say socioeconomic and cultural barriers that prevents many women and gender diverse individuals from accessing proper healthcare. And the second one, gender bias in medical research. Medical research has historically centered around males, leading to misdiagnosis and ineffective treatment for women. For example, heart disease is often missed in women because symptoms present differently than in men. And the other thing I mentioned before, leadership disparity. Women dominate the healthcare workforce but remain underrepresented in leadership, a phenomenon known as the glass ceiling effect. The other thing is healthcare access disparities. Women and gender diverse individuals face barriers in accessing reproductive health services, support for gender-based violence, and LGBTQ plus inclusive care. So gender inequality in health leads to significant disparities affecting both women and men. Women are more likely to suffer from chronic conditions like heart diseases and chronic pain, often facing underdiagnosis and delayed treatment due to the research gaps and gender bias. Despite having a longer life expectancy, women spend more of their lives in poor health. Financial barriers, lower incomes, healthcare biases further limit their access to care. Actually, there are some great policies and initiatives, including WHO and UN programs, national policies, and case studies from different countries to promote the gender equality in healthcare systems. And while preparing this speech, I actually searched some of them, and I noticed that these policies and initiatives represent a global commitment to advancing gender equality across various sectors, aiming to create inclusive societies where everyone has equal opportunities and rights. Of course, healthcare professions and organizations are the heart of this change. By prioritizing gender equality, patient care and outcomes improve, advocating for gender transformative policies ensures long-term systemic change. Promoting women into leadership roles helps shape inclusive healthcare policies. Empowering women in community health roles amplifies their voices and contributions. So where do we go from here to create lasting gender equality in healthcare? We need to build gender-responsive health systems, ensure comprehensive reproductive and sexual health services, address gender bias and in clinical practice, invest in women's health and economic participation, engage men and boys as allies in this fight, close the gender pay gap in healthcare, advance gender inclusive medical research. To wrap things up, gender equality in healthcare isn't luxury, it's the necessity for better health outcomes, stronger communities, and more effective healthcare systems. Healthcare systems are more effective when they prioritize gender equality, and we all have a role to play. Whether you are a policymaker, a healthcare professional, or an advocate for change, your voice matters. So let's make a future where healthcare works for everyone, regardless of gender. Thank you. Thank you again.
Thank you, Dr. Umut, for sharing your experience from on grounds and doing your great work at delivering the services to those who are really needing it, especially the eye cataract surgery, which is, of course, not a small deal. And when there are many people who are losing the vision, especially in the older age, when they are getting into the senile age and getting cataract. So thank you for caring those people. And for your work. And as we have wrapped with our main remarks from our panelists on the great topics, just a brief remarks for our audience that after our I'll be having some questions, and then after our questions, there will be a floor opening for the audience. And if you want to, ask your question, feel free to raise your hand, and we can take you to the panelist section. You can either open your video if possible and ask your question. So please feel free to raise your hand, write your questions, and be interactive as much as you can, because this is a great panel and we would love to have your interventions as well, or your experience or any of the questions. So I'll be moving with some of the questions that I have, as this is a great opportunity even for me to, having these experts and learning from their own experience. I would like to ask that, and any of our expert speakers can answer that, and I would appreciate having all of our expert speakers on the screen. The question that I'm having in my mind is that what kind of the most urgent actions that are needed right now to ensure that women's health is treated as a human right rather than a privilege? And especially we are discussing about, the policy recommendation and commitments for this Beijing Declaration. So it is a very important time actually to prioritize and most urgent actions that are really needed and immediately needed to ensure this as a human right. So please feel free to move ahead and take the floor and share your remarks. Thank you.
I can start probably because I think the most critical issue is education. As I mentioned earlier, what happened with COVID was we went overnight to a place where we could offer education and healthcare remotely. And if we can educate women about healthcare, if we can educate refugees, a lot of women and children, when the whole school system and hospitals have really fallen apart, if we can provide remote care, remote education, which means closing the digital divide, I think we can get a start. The issues are extremely complex. We are not going to solve poverty issues. We cannot solve gender gap issues overnight. We cannot solve human trafficking issues. We cannot bring peace when there is so much money being spent on war, right? So these are kind of things that we should all do, and it's not going to happen. What is the one thing we can do? I think at the minimum is to educate women about their health and the health of their children.
Thank you, Atefeh, for sharing it. Dr. Michelle, would you like to share anything about it, the immediate urgent actions that are needed?
I think the emergent issues are really around localizing response. I think I saw in the chat comments by various attendees around the global funding shifts and specifically the destruction of US aid. I think, in the humanitarian sector alone, which serves, displaced women and children, 40% of the world's humanitarian budget came from US aid. And so the effect on women and children is going to be catastrophic when it comes to delivering HIV services, preventative care, gender-based violence, nutrition, vaccination. And so we need to really work within local systems to shore up efficiency, strength. I think some of the specifically East African leadership has come out with strong and important statements on the need to build into local systems and invest. And I think Dr. Manzi talked about investing. The president of Tanzania recently redirected funds from a more celebratory milestone of the country to dedicated health needs, which I think shows real leadership and real vision around building systems. And so I think the urgent need to really localize and build systems is, I think, one of the most important concepts.
Thank you, Michelle. That's very important. And yeah, regarding the finance system right now, regarding the fundings and cut off from USA, that's actually impacting worldwide, and but we must move out of all of the adversities that we and uncertainties that we are having right now. I'd like to hear from Dr. Manzi as well. Would you like to share your experience and things and remarks out of it?
Yeah, no, thank you. I think Dr. Michelle, you put it really well. Building systems. I think, I would add on that it has to be. Um, we have to build our systems based on the reality that we have been facing for many years. We knew that women were dying. We know women don't have access to care, and we have all these statistics. How do we have data driven systems design, human centered design, women centered design? All these are concepts, but we definitely should react that way. I think, it takes leadership. I want to add on the power of leadership. I am originally from Rwanda. It's a country where over 60% of women, the parliament, over 60% of members of parliament are women. And that's a shift in people's thinking system. And you could see women designing the future of the country. How many women are designing the health system that we have? And I think we definitely need to just leave the politics and actually get to the data. And I say, who is paying the highest price? It's just the women and children. And why don't we actually invite them to ask what they want? And the problem is that we always talk about, yes, it's as if someone else is meant to design a health system for women. And I think we are at the point we need to use the data that we collect to reimagine our system. And I also want to echo my friend and mentor, Dr. Farah, who's online. I see his comment there, repeating what Paul Farmer said, that the idea that some lives matter less is the root of all is wrong. I think I do agree with that. And when we don't see women, it's as if it's another race. Come on, we're gonna have to react using the data, and we're gonna have women actually design the health system or be part of the system that we need, because the system we have is vertical. It's someone else designing that system, and we collect a lot of data. We don't use the data to inform the system that we want. And I think it's time for us to say, with all we're facing, we always, when I'm in equality improvement, we always have this saying that every system is perfectly designed to achieve the result it achieves. The system that we have is well designed to not give access to women, access to care. I think we need to reimagine the system we want to be able to actually promote the real universal health coverage. I think that's what I have to add here.
Thank you, Dr. Manzi. That's quite good examples that you mentioned in terms of relating it to also the social medicine. And I'd like to hear a bit of it as well from Dr. Umut, if you have anything to share on the same, and then we move along.
Yeah, thank you. So yeah, in my perspective or in my work, I always focus on individuals. What I mean is, if individual do something, the one person do something, I believe it change big picture. So everything starts from one. So if we start to do something in our individual life, I believe it will change the big picture over time. I know it takes time, but yeah, we are the basics of the system. Each person is basic of the system. So, for example, in my services, I'm doing all my services by myself. I am opening funding online, and then find money, and then go Africa and do the surgeries. Yeah, try to help people, and specifically women and girls, in my perspective always. So yeah, if we are aware of the issues in the system, I believe the system will improve over time. Thank you.
Thank you. And yeah, I agree. And I'm sure that all of our speakers and audience will also be agree that the change always starts from one as well, and then others will just follow, one. It's always the kind of like a step back that we always think that, okay, I will not make it, but believe me, that even if you're thinking about it and doing it, then people will join you, because many are there who are thinking likewise that you do. So thank you for your work as well. I have one more question, and then they will be moving to the our audience question and answer session. As I can see, there are a lot of good comments and questions that people are having to ask from you all. My next question is that what kind of a role can community driven projects or approaches are playing in addressing the gender-based health inequities, and of course strengthening the women access to healthcare, and how we can hold governments and institutions accountable for reducing gender-based health disparities, as you all mentioned about the grassroots experience, the work, the community involvement, and then and healthcare is just not limited to the medical diagnosis of a disease, but it's having really great social structural factors. There are a lot of forces around it, and how we can ensure that community driven approaches are important while making the government more accountable. So I would like to hear all of your thoughts on this question. Thank you.
I can go first, and I think the role of communities, I think this is actually powerful, and it could be also an extension of the answer that I think Dr. Michelle gave on the funding. I think communities hold the power. They hold the power to really, to be resilient, but also to influence the decision and the policies. It's about the platform. So if given a platform, communities have really a force, the power to design a system they need, where I think the voices of women would be heard, and where they can actually say, this is a pathway. Oftentimes the pathway for care are designed in Geneva or in high offices. What if that was the other way around? The communities actually define the pathway. I think that is a potential power. And I think that is the way to even cope with what is happening, funding wise. I have to say, I work at Partners in Health. It's been 20 years. We use a model we call accompaniment. With the accompaniment, it is community members accompanying their neighbors to the health facility. These women coming, knocking on the door and say, I have been there. This is how I navigate the system. Come with me. I think that is really the community healing the community. And I think that it's about time to have communities actually play that active role and really have these community-driven, community-based accompaniment approach that is going to get women sick and actually access care where they are. I will stop here.
Can I make a comment on that? I mean, you raise a really important point about communities. What I wonder is about communities are not necessarily unbiased, right? I mean, the issue is the women's rights, the gender gap. There are lots of traditional thinking, dogmatic thinking. There's a lot of pressures within communities that hold the women down. So how do you rise beyond it? I mean, the women are struggling in these communities. Many communities, if you think about those in war zones, refugees in camps, those are like have fallen apart. And I think someone raised this issue that this is not only a women's issue, this is also a man's issue, this is a society's issue, because when women are not healthy, society is not healthy. Women contribute to 60% of food production, 50% of the revenue globally. They get 10% of the revenue globally and own 1% of the land. So within these communities, we have serious issues of gender inequity. And I do think community is critical, civil society is critical, but I was going to go back to what Mehmet said a couple of nights ago at a dinner, which is partnership. It is public-private partnership, and it is for much of the private sector to realize that the health of a woman, health of a child can generate revenue for them, can generate profit. Healthy societies are societies that can get jobs, they can become consumers, they can become part of the productive part of the society. And I think if we can't get to that point, we can't get the private sector engaged. And if we don't get them engaged, we can't get investment that we need to make in communities, in countries, in societies to get that equity that we're looking for.
Building on what Dr. Manzi and Atefeh said, communities and the private sector and building the economy requires data. And that data needs to be destigmatized at the community level so that data is generated from communities to justify need and demand for supply and demand from the government, as well as governments destigmatizing the number. As Dr. Manzi said, a system will produce the results it's designed to produce. And often data is produced to meet the indicators that are set. And so we need to really take a deep look at country level and community level data, destigmatizing what's reported and how it's reported to really truly justify need and demonstrate progress and impact.
Amazing. Yeah, data and statistics are very important when the governments even plan to design or implement a certain healthcare program. And of course, as Dr. Manzi mentioned, the concept of accompaniment and participatory, inclusive community participation in any kind of healthcare intervention and designing is very important. And community holds the power. So it's always the bottom to top approach, but sometimes we need the top to bottom approach. And but I would say that the concept of accompaniment holds power here as well in terms of community accompaniment, and then when we work in the healthcare spaces. Thank you for your remarks. Dr. Umut, would you like to share brief remarks about the same?
Yeah, actually, my opinion a little bit pessimistic, so that's why I wouldn't share it. But when you ask me, okay, I will share it. Okay, so I'm pessimistic in this topic actually, because the governments or big companies or big communities working a lot of things, and the gender issues in the last, I believe. So that's why I don't think we can move easily in this topic, in this subject. So yeah, I hope, but I don't see anything to, at least in 5-10 years, I don't see big changes, in my opinion, especially in Africa, I can say. Everything is going maybe bad to me because, for example, in Mali, there are women villages. Only women lives there because they have some diseases. They are they cannot control urine, and then so they smell bad in the community. So then community leaves them outside of the cities. So they are living there and they are still there, and nothing changed since 10 years. I'm traveling here. And yeah, I don't see any changes. Of course, this is maybe the other part of the world, but actually I am seeing same things in Canada, in continent of America. So yeah, this is my opinion about that. Sorry for that.
No, it's completely fine. And I think to understand the broader context, we should, be pessimistic and optimistic at the same time as well, to understand all of the dimensions
Yeah.
of the problems and solutions. So understanding every corner, every dimension is very, very important. And thank you for sharing this example. But we still hope, and we all keep trying and creating the change. So thanks for your remarks and sharing this. And now actually it's time to move with our audience who are waiting for a long time to ask the questions. And I actually have the question I'm reading actually. Faith Ruto, would you be please able to be on screen and ask your question, or would you like me to read your question? I saw your hand raised. Faith Ruto. Oh, hi, Faith. You are muted. I think my colleagues can help her to unmute herself. She's muted. Faith, can you please unmute yourself? Sorry for the connection. You can just click unmute and you will be able to unmute yourself. She's having a great question. Yeah.
Resolved. So I want to say good afternoon or good morning, wherever everyone is joining from. My name is Faith Ruto. You may know I'm already from East Africa, originally from Uganda. I just wanted to commend the panelists for all their tremendous information, their kindness that came through really well. I just wanted to share a bit of a story about my cousin and the link to gender inequality and the role of healthcare professionals. She suddenly lost a baby. It wasn't due to her, but due to the practice of the healthcare. And my question, I guess, to the panel is, how do we help women, to get quality care, but also how do we, educate health professionals in, countries in Africa and other countries to take responsibility? Because obviously that's one child lost to one family, but it could be even many more. So the woman is getting the health, is getting access to health, but then it's not unfortunately treated well in the hospital. So that's just I wanted to share that personal story, but also to ask the panel, what else can women or professionals do in those kind of situations. Thank you.
Can I take that? Because I'm a big proponent of education and women taking control of their lives and their children's lives. And there's a question from someone about AI and technology. I want to bring that into the fold because I think we are able, if we can close this kind of gap on the access to the internet, we can bring a lot of awareness and education to women to help themselves and help their children. Unfortunately, going back to the communities, there is a lot of kind of old views that we need to overcome. Viruses are bad, or this is bad, or that's not. I'm sorry, vaccines are bad, or if you go to the doctor, they're gonna make you sick. There's some beliefs we need to overcome. You can only overcome it from education. And if you look at diagnostics, basic diagnostics, today, for example, you can go to Amazon and get to see a doctor remotely for, I don't know, $29. And that's it. So if you think about access to healthcare, we've overcome so much of it. And if we can make women aware that it doesn't matter if you're 100 kilometers from the doctor or the hospital, if we can address 70-80% of the issues remotely for you, and you have access to it, you should take advantage of it. Of course, it's really hard to do that in so much of the South. But I see, if you think about explosion of access to cell phones, it's actually in Africa or in Latin America, Middle East, most people have access. Women have less access, but still there is access. So I just think that education technology can help. And the question is, how do we raise awareness? How do we help the women to educate and be aware and begin to help themselves and family? Because I'm pessimistic as well. When I look at the world situation, when I look at poverty, when I look at gender gap issues, there are so many issues here that we cannot solve overnight. But we can give access and knowledge to the women and get them to start helping themselves, because otherwise we're going to have this conversation 5 years from now, and we're going to talk about the same social issues.
I would love to comment. I disagree a little bit with the last statement. We can give all the technology we want, but if we don't have a change in the culture of the way medicine is practiced in many locations, it will not matter. So I practice in a very high risk specialty, the front lines in an emergency department, where you have to touch a patient, you have to take risks and do emergency procedures, deliver babies, do all of the things that results in these catastrophic outcomes. In the places that I've worked, over 30 different locations, healthcare workers operate in a culture of fear and punishment. You know, the United States made a journey. One of the things I think we can represent from the United States healthcare that has made progress, you know, through the Crossing the Quality Chasm report, where quality has to have a culture. It has to have governance, and it has to be governance to improve and to learn and not to punish. And so I see every day amongst my physician and nurse colleagues globally, the fear of punishment, the fear of retribution affecting their willingness to intervene. And they will walk away from a patient over risking their entire career. And the fact that they can help more people that way than the one person in front of them now. And until that culture changes, technology and education will do nothing. And so governance, leadership, and the culture of medicine has to evolve globally to be a supportive culture that promotes learning, systems education, and preventing errors and mistakes, not individualistic practice.
So can I come in, given Michelle? I think I'm going to second your optimism. Definitely, I think overall, we're going to need this collective optimism to be able to get access to care. And I am saying this obviously from my experience. I think I am from a country where, you know, genocide, the 1994 genocide really devastated the entire system, and obviously the entire country, you know, and I have seen women actually taking charge of their health and the system. You know, I think now I'm very optimistic, especially with access to information. So when you look at the cellular access, right, so the network, access to internet, now I would say over 80% of, let's say, my small country, Rwanda, over 80% of the population might have access to a cell phone. And imagine how much information they have on their fingertips. And I think that is really important. And looking at the post-pandemic efforts, so everyone is really trying to set up a system, mainly decentralizing systems, so it is actually at a community level. But I really want to come back to Faith's question. I think this is a very good case study, because we're talking about a new ways of thinking in medicine. And, you know, I think someone asked the question, what is the difference? What is the social medicine? You know, think about how many, the most recent visit you had when you visited the doctor, how many doctors talked to you the means of transportation? Did you have means of transportation? Are your children in school? Did you have immunization? Did you eat? So do you have a job? Do you have a source of income? So how can I help you? How do we connect? Because we are a whole. So social medicine is now being introduced in so many universities. And I want to stress that as another opportunity that we have, because most of people who went for health education were trained in biomedical. This is the diagnosis, this is the treatment, and you are a very good doctor when you can do this. But how many of us were taught how to ask, did you have dinner last night? Are your children in school? Because for me, you can't treat me for malaria or HIV, without knowing if my children are able to make it to school. So I think the other thing I want to say is that we're going to make a transformation in our global commitments. How many of us have learned about MDGs, Millennium Development Goals, or Sustainable Development Goals in their pre-service education? So now we have these declarations that are sitting on a website somewhere and never make it to pre-service education. So our social medicine, our education system have to change for us to be able to integrate these social medicine principles, but also these new guidelines. So people are graduated and they know, okay, what is that? What is the MDG or SDG that is talking about gender and women? How do we address these gaps? So anyway, I want to stop here saying I am really very optimistic that we could make it happen. But just like, Faith, nephew or niece, I think it's really important to get into the root causes and say, is our system leaking? Do we need to patch or we need to rebuild the system? And that's really important. If the system is not addressing, women's gap, women's health needs, maybe that has to be rebuilt. And we invite women, we invite others to actually be part of that re-envisioning of the health system. I will pause here. Thank you.
Well, that's great. So we have all kinds of views for the same, and really appreciated that how you delivered based on your own experience. And um, I also agree that the cultural sensitivity and the proper awareness inside the community is very important, and education plays an important role. And technology and innovations are our assets. So if we have that proper, then we can use that efficiently. So now moving on, we have our another from audience, actually, Mr. Foro, having great questions, and he's on the screen right now. So over to you, Mr. Foro. Please ask your questions from panelists. Thank you.
Well, thanks. I put some questions in the chat, but I thought and it's great to see you. Dr. Manzi is the only person I know, but I've been inspired by all of you. But to try to make something really, really concrete, which connects to pessimism and optimism. 12 years ago, for the 100th anniversary of the Albert Schweitzer Hospital in Africa, I at the time was president of the Albert Schweitzer Hospital. We had a big global conference. But one of the concrete things that we demonstrated, this is 12 years ago, was with someone named Milton Chen, who's a tech person. We had a medical student at the hospital from here, and we just showed him how to take Milton's portable ultrasound equipment, and just all medical student knew was for a pregnant woman where you put the probe. And then that medical student went 2 hours upriver to a village that had no cell phone signal and no electricity, where there was a pregnant woman. But Milton had borrowed from Intelsat a satellite phone, battery powered, and that medical student could then, by putting the probe in the right place, broadcast the fetal ultrasound on that pregnant woman, which was read live by the doctor at the Albert Schweitzer Hospital and read live by the head of high-risk pregnancy at my hospital at Harvard, and basically showing at a marginal cost of zero when you had that equipment, any woman in the planet could have access to any knowledge in the planet and want to stress what Manzi and others stressing how things start with individuals. But that was still the mindset of, oh, we're delivering care to some woman. I want to say two things. One, those same technologies, as Manzi said, almost every woman in the world, they don't themselves have a cell phone, but their village does, has one of these, which we think of as to receive the health information. But these are bi-directional devices. Every woman on the planet could express her voice, her needs, or her wisdom about what's needed locally if we use these devices in that way. And then in terms of individual action, again, Paul Farmer, just a hero to so many of us, people stress what Paul as an individual and then with Jim, Kim, and Ophelia did individually in Haiti. But we neglect to say, where did Paul's fuel come from? His fuel came from each individual person and encounter he had in Haiti. And the courage, the energy, the wisdom of the people of Haiti, who he considered his greatest teachers and his greatest fuel, taught him and energized him. So there are win-win-win things. And then getting back to that, people can say it was a heroic thing, the medical student in this village with no electricity, no cell phone signal, and oh, isn't it great that that woman was helped? We neglect the fact that the doctor I knew, head of high-risk pregnancy at Beth Israel, that was like the best day that he had had in years because he felt excited about being connected to that woman. So there is win-win here, things all over the world. But as Michelle said, our current system, our systems and our culture are blinding us to the fact that those are right there. And so my question in the chat is always, how? Because I think the possibilities are infinite. How do we get more and more people aware that even though I'm just one individual, there are individuals all over the world, including all of you on the screen today, that are thinking about this. And if we can organize systems of that, then it's the power of that woman in each village, like the power of each woman and girl in Haiti for Paul. That power can be unleashed to fuel ours and change the world.
Thank you, Mr. Foran, especially giving the example of Paul Farmer, who is like the kind of the ideal person that I got inspired, and I'm currently doing my master's in global health delivery, which was designed by him, and I'm a student and learning a lot of things from his work, from our department, and all of the visions that we are having in our department about social medicine and how we care for our patients. Thank you for sharing this. And I'd like to move to our panelists if any of you are having kind of relatable remarks or any feedback on what just Mr. Foro mentioned.
I could go and I would probably be repeating what Dr. Foro just mentioned. I think, 5 years ago during COVID, I visited a place that's where I grew up in Rwanda, and I found that the school that I attended as a child, they had no PPEs, no soap, no running water, no electricity, nothing. And from there, I founded a nonprofit. I think you mentioned it in the intro, Move Up Global. And the reason I'm mentioning this is actually the power of linking communities and the technology that Dr. Foro mentioned. The first step obviously was to help get electricity there. And after getting electricity, we actually found someone with that cell phone. And we started Zooming every weekend saying, by the way, this is how the virus is. This is actually how you can protect yourselves. And from there, actually, we reached a point and say, okay, there's no soap. Those women in the community, they say, okay, we can actually make soap. Now they're making soap. Since then, it was initially, oh, that's right. So Dr. Foro has a soap just from the same project. Thank you. Yes, that's fascinating. I had no idea you had it. So, that is the power, linking the communities with that technology. The magic could happen. So now we have women protecting their families and their children, and eventually women who are now thinking about having a factory, to be able to actually, have, some development in their communities. So, and that obviously the list goes on. Now we see the same schools that were the least performing in an entire district, as we speak, they are the top performing in an entire district because the health of their children changed, because their perception of health changed, because now they are linked to their local primary care. So I think that we need to think about ways to introduce and use technology, really coming, not the technology being the actual driver, but the message and the purpose are actually driving, telling the technology what we want to do. And I think that can happen anytime and anywhere. So I think I wanted to just use that example to highlight what Dr. Foro just mentioned.
And if I can just add, the technology it makes possible. What matters is the relationship and the accompaniment and those human connections that are bi-directionally inspiring. So one of the things now at Manzi's school now, they have a collection from here of 30 children's books. The kids are so excited to be reading those, and Manzi and I are talking about, because I can't think of anything more exciting to an elementary school in Roxbury and the mothers and children there than to be connected with Manzi's home village, and they will fuel each other.
Thank you, Dr. for joining us and sharing your comments and feedbacks. We are very happy.
I'm going to get off
that
screen
you
now
joined
because
us.
this is your panel. I'm going to get off screen now.
But you are now one of us. And Dr. Atefeh has left as she's having another meeting, but I would like to hear some remarks from Dr. Michelle and Umut, some final closing remarks as we are wrapping our session. Very brief, and then we'll be wrapping up the session. Over to you, Dr. Michelle or Dr. Umut.
Yeah, I mean, I would return to the way we started, in that women's healthcare needs to be led by women, with the voices of women elevating their solutions locally. I think, we've had trailblazing leaders in the past, predominantly from high-income countries of white origin, and we need the voices of Dr. Galadanci, Dr. Marshall, Nurse Amber, Nurse Shirley, the people who have created new ways of doing things to reach a global stage so that others can learn from them.
Thank you. Dr.
Yeah,
Umut.
what I can say is actually my perspective is wider now, because I didn't actually join this kind of meeting before, and then I didn't know the other parts of what we can do. So it gives some ideas to me in my mind as well. I hope, I can do something more to inform people, inform women, girls, to make their life change, how they change their life. So yeah, thank you for this great meeting.
Thank you very much. It's for me, it's such an honor actually to moderate this session and learning a lot, and engaging this in this amazing panel. And as we are almost about to close our session, I want to send my heartfelt thanks and gratitude to all of our audience who joined us from all around the world, despite of the time difference. And to all of you speakers as well for this all thoughtful contributions to our audience, for engagement. And this session was actually very important for centering our conversation towards human rights, gender equality. Then we talked about social medicine, health justice, great legendary examples like Dr. Paul Farmer and other concepts that Dr. Manzi and Michelle also mentioned about data and statistics, the role of technology. Everything is very important, but we need a certain perspective to, move along and connecting all of the dots that we learn and move So the goal of the Beijing Declaration and Platform for Action, as well as 2030 Agenda contribution, is very important, and this panel is serving as an example for that. And after wrapping our sessions, all of the session at CSW, we actually publish our proceedings and share to our global partners. So the remarks of this session will be published as well. So thank you for your great contribution to this amazing panel. And again, thank you, and I wish you a great day ahead, or good night to those who are joining us from South Asia part. I can see a lot of people here. Thank you very much for joining. Have a great day.